As the world recovers from the aftermath of the COVID-19 pandemic, there is another virus on the lurk, the H3N2 influenza virus. India has already reported at least 5 deaths from the virus, with total cases exceeding more than 1,000 various parts of the country. How concerning is this, and what precautions should you be taking against the virus? To answer all these questions, we are now being joined by Dr. S.K. Sharma, former head of the Department of Medicine at AIIMS. Thank you so much for joining us, Doctor. Right. So the basics first. What are the symptoms and how concerning is the virus?
You see, actually, these months, actually, when the month of December, usually after, say, when you have winters like December, and when you are entering in January, February, and March, there is a shift in the weather also. So during these months, one usually comes across viral respiratory infections. So viral infections are the commonest one, and they usually involve upper respiratory tract, and that actually includes your nose, nasopharyngeal passage, and oropharynx, and it may go down also. It may descend to larynx and trachea and lungs also. But common, that is the lower respiratory tract. But right now, actually, we are talking about the spread. It is just like COVID, actually. You can akin to that. These days, we have variants of SARS-CoV-2 and several variants are there. So it is just like that. These mutants rarely go down, and they are confined to the upper respiratory tract. So likewise, these this winter season, actually starting from there is actually very strong surveillance program going on, and health information platform also, which is integrated disease surveillance. It's a real-time surveillance going on by the known as integrated disease surveillance program, and it's available for the public also, and is through the health ministry. Union Health Ministry, integrated health information platform. So the surge in various viral infections started mid-December, actually, and it has been...
Right, doctor, just to interrupt there, you mentioned about the symptoms, and you also emphasized on how it is similar to that of COVID-19, but what are the precautions that people should be taking against the virus?
Actually, usually the precautions which the public needs to take, or when one is actually outdoor, and when one is indoor in the household, when people come back after their daytime work. So the principles remain same as actually we were doing during the COVID-19 time. Those actually include proximity, one-to-one actually, and if you are getting, say, cough or
right,
nose running, so nose running. So, for example, usually if you are coughing in India, actually, one observes that cough etiquettes are not observed by people. If the person is coughing, he will invariably try to cough on your face. So first thing is actually that they should keep this thing. There should be no 1:1 this thing. So the other person should not get these viruses actually are very small, and it is through the droplet actually which one will acquire. The major source is actually One is actually schools also. One is actually, as I said, actually one is traveling at the buses, etc. And buses are overloaded, and you are not using precautions like face mask. Then actually, but most of the people are very allergic to wearing or putting on, even
Right,
during.
doctor. Right, doctor. Just to add to that, Puducherry has already asked schools to shut down because of the surge in this H3N2 virus. But experts also say that the H3N2 virus may be more severe this season because of the fact that in the last 3 years, people were using masks extensively, and maybe the H3N2 could not enter the body back then. So what is your observation on this?
No, we are seeing even in US actually, yeah, in Europe also, people are put. If you put on mask, then you are protected. But also it depends on your hand washing, etc. If actually and the same precautions actually, if you are opening the doors, so it may be stuck to the virus, maybe stuck to the handles. So all those precautions, and actually, if you are touching directly, then your nose and eyes. So the virus will make the entry into your respiratory passages. So, and another thing I was hinting at that schools are open actually. You might have read also in the newspaper that for some time the schools were closed down also because school children actually are small and they don't observe, they play and this thing, and they are sitting side so many this thing in the desks, etc. They are in the classes, they are sitting, so they are spreading from one to another, and they are also bringing to home also there. So that is also important and must be considered. And any other thing you want to ask?
Right, doctor. Yes, just coming to that, like you mentioned that kids go to school and from there the virus can spread and come back home and also spread in their community and neighborhood. I want to ask you that who is at a high risk of the virus? India has already reported at least 1,000 cases of this H3N2 influenza virus.
No, actually, all viruses are prevalent, but yeah, you are right in saying that H3N2, which is a subtype of influenza A, and there is actually Victoria influenza B is also there. That is actually, and majority they are approximately 80% actually are constituted by S3N2. That is a subtype of influenza A virus. Influenza B actually about 14%. H1N1 we call it as the other name is swine flu. It is about 7%. And even actually variants are circulating COVID variants. That is actually this constitutes about 3.24%. So this is the breakup in when one looks at proportions.
Right, doctor. And how effective is the influenza vaccine against the H3N2 virus? Do you think it can work or no?
You see, actually, first thing is actually there are what we call it as immunization for adults. That means actually more than 18 years. There are certain, but after 65, we usually recommend, and usually one tries to modify the recommendation which are made by American College of that makes vaccination guidelines, and every year they are revising this. So this time actually on 28th of Feb, we had recommendation issues by them, but this has to be moderated by this thing. Usually in India, actually we recommend that 65 years age as the cutoff. But if someone has got multiple comorbidities like diabetes, which is highly uncontrolled, and other risk factors, besides age also, age is also one of those, and other ailments in the individual. So then actually we recommend that they must get annual. Usual month is actually October month. So we recommend that, and every year it is reconstituted based on circulating viral strains. So we know we have there is a very strong influenza surveillance program also, and lab-based data we have. For example, in India, actually, Nari Pune actually, and that is the ICMR's sponsored center, and then WHO surveillance center is also there. They coordinate, and there are 27 sites also across country, and they are monitoring actually what are these strains, and based on that actually
Right.
we recommend that. And I think the question you asked actually, so there are no systematic studies. There are some ethical reasons also. For example, if we take one group which has not been vaccinated, but then this is the ethical question actually. So we will not like anyone after 65 to be left out. So why they should be left out? The another thing is actually some patients I was mentioning about comorbid condition besides age, actually like chronic lung diseases and chronic heart diseases like past history of heart attacks, etc.,
Right.
congestive cardiac failure. They are much more prone to develop, and
Right. Just
several.
to add to that, doctor, like you mentioned, that a lot of 5 people have died in India because of the H3N2 virus. 2 of them already had comorbidities. But my last question to you before I let you go. Now, New Delhi's Lok Nayak Hospital has already set up a 20-bedded isolation ward. In your viewpoint, how prepared should New Delhi be against the H3N2 virus?
So it again depends actually. The ages which I mentioned actually, we call it actually in medical science as extremes of ages. Actually, if the person is past 65 or even earlier, like past 50, and has got several comorbidities, so they have to be protected as we were doing in during the COVID-19 pandemic. The another is actually I hinted at school going kids actually, and say the young children. So they are, and especially first 5 years of age. So these are much more because the immune system is not functioning at maximum.
Right.
So, and 65 also same logic is given, or people who are taking steroids and other immunosuppressive agents. And disease can be lethal in elderly individuals because they have comorbidities, sudden deaths, admissions to
Right.
the ICU, etc., and it can overload your
Right.
healthcare system.
Thank you so much for joining us, Dr. S.K. Sharma, and sharing your insights with us on this. Thanks very much.
Thank you very much.